eye health screening is a crucial component of the overall health assessment of every newborn. Soon after the baby is born, the health worker attending the baby should screen the baby's eyes along with the other health checkups. The follow-ups are also equally important and should be done at every subsequent health check visit. The same test to be done again and again at every checkup. This video is going to demonstrate two relatively easy eye tests that can be performed on the newborns by any health worker or even a family member. And if any abnormality is detected during these tests, then the infant should be seen by an eye specialist at the earliest. But hygiene first. The hand sanitizers alone are not sufficient to eradicate viruses from hands. Hence, the eye examination should be done only after thoroughly washing the hands with soap and water and then drying them appropriately. This should be repeated both before and after checking each baby's eyes. Unclean hands or wet hands will spread infection from one eye of the baby to the other baby. Also ensure that the examiner doing the examination does not have long nails that can injure the eye. Always remember to dry your hands after using hand sanitizers, as these should never come in contact with the eyes. So let's get going. The first test is a simple torchlight examination. Gently open the eyelids apart without pressing on the eyebrow or the bone region, and do this in a child when they are happy and well fed and they are not crying and cranky. Check one eye at a time, and when you want to compare both eyes, then open them simultaneously. The parts of the eye that will be visible are the eyelids, the surrounding area including the lacrimal sac area, the conjunctiva, which is the outer covering of the eye, the cornea, that is the front transparent part of the eye, and the front part of the eye behind the cornea called anterior chamber. The pupil, as all of you know, is in the center of the eye, and then the iris is the colored part of the eye, which is often blue or brown and which gives the color to the eye, and then the lens, which is a transparent layer behind the pupil. Now, what do we want to look for? We want to look for the size of each eye. Are they equal? Are they normal looking? Is one eye smaller or bigger? Then we check the lacrimal sac. Usually children who have lacrimal sac problem will get discharge, watering from the eyes, but you can check for it by gently pressing the inner corner between the lids and the nose as shown in this video, and look out if there is any pus or mucus coming out from the underlying lacrimal sac around the eye. If there is any difference in the appearance of the eye, or there is defect in the eyelids or swelling around the eyes, or any discharge, redness, transparency of the cornea is lost, or the clarity of anterior chamber is not there, or the shape and color of the iris or pupil, then these are abnormal. Normal pupil should be round and central, and the center of the pupil should be transparent, and the color of the iris should be same in both the eyes. If any abnormality is detected during this torchlight examination, then the infant should be sent to eye specialist at the earliest. This test, torchlight examination, can detect many common eye problems in the newborns, and so it is something which can be done, but it is not normally done. Now, the more important test is the red glow test. Now, the red glow test, it helps in detecting a few more common eye diseases and more serious diseases in these babies. After the torchlight is done, put one drop of 1% tropicamide eye drops 2 times in the eyes of the baby, and this should be done 15 minutes before the red glow eye examination is done. This eye drop helps to dilate the pupil safely and sufficiently for the test. Alternatively, if we don't want to put an eye drop, then we can do the red glow test by keeping the baby in a completely dark room for a few minutes. These pupils will dilate in the dark, and then we can get the red glow, but sometimes this may not be sufficient for all babies, and that is why by using the tropicamide eye drops, the test becomes more easy to do. To check whether there is a red glow in the pupil or not, one can use either a digital camera or take a close-up photo of the eye, or more commonly what we like to use is a direct ophthalmoscope that all doctors use to check eyes of patients. A normal eye on photography and on ophthalmoscopy will show that the center of the pupil has a bright orange-red glow, which you also sometimes see in bad photographs, that a red color comes in the red eye. If there are abnormalities of this red glow, then it may look white, which is called leukocoria, or yellow or no glow. If the glow is different in two eyes, that is also abnormal. In such a case, the pediatric eye specialist or the special eye specialist should be consulted at the very earliest, because these are serious eye problems. Now, while these tests that I have described will be able to detect any visible abnormalities in the eye, they will still not be able to detect any serious or rare eye problems in the inner parts of the eye. To detect these, all high-risk babies must undergo complete fundoscopy or fundus photography by a trained eye specialist or trained health worker, in addition to these two tests which should be done in every newborn. So what are these high-risk babies who need more detailed examination? First of all prematurely born babies must undergo a retinal examination within 20 to 30 days of birth, and this should be done by an expert who is trained in ROP. ROP is a serious blinding disorder, and the babies become blind within 2 to 3 months of birth. So all premature babies, as defined by your country's guidelines, must undergo eye examination within 20 to 30 days of birth. Those infants who are detected to have any other congenital abnormality, that they are born with some abnormality like incontinentia pigmenti, or they have some syndrome or a metabolic problem or genetic problem or multiple fingers or heart problem, any problem if the child has been detected to have, then they should also undergo eye examination, because many times the eye is involved in these diseases, and also the eye can provide the clue to the diagnosis. Those babies where there is a family history of the parents, siblings, first cousins or other close relatives like uncles who have had eye problem in childhood or young adulthood, they should undergo a very detailed eye screening. And in fact, if the elder child had an eye problem, then it is better for the parents to have more detailed discussion with the doctors even before they become pregnant next time or during the pregnancy, rather than waiting for the newborn child to have the disease. Now, infants who are sick, that means they were admitted in hospital with infections like HIV, like some eruption, viral infection, rubella, septicemia. If they had IV line, that is saline, for more than 2 weeks, then they are at risk of developing infection inside the eye, which can remain hidden and which can be treated if detected on time. So these children also should have very regular close follow-up for eye infections, and they need a detailed fundoscopy. The last but not the least, the babies who are not having eye contact or don't follow an object, as you see in the video, or have an abnormal eye movement, that is the eyes are moving up and down, or they are shaking, or they are looking sideways after 6 weeks of birth, and those children whose mothers complain that something is wrong with the eye of my baby, these babies must have detailed eye screening done, including fundoscopy. What we have noticed is that it's usually the mothers who suspect and notice eye problem months ahead of others, including doctors. We hope that this video will help to save many eyes from going blind and help the health workers to detect the problems in the babies early enough to receive treatment. If there are any questions or queries, please feel free to contact us through the emails provided at the end of this video.